South Africa has registered its highest number of infections to date within a 24-hour cycle. We continue with our conversation and an update on coronavirus. We're now joined via Skype by political analyst Dr. Ntsikelelo Breakfast. Doctor, thank you so very much for joining us on SABC News. We do appreciate you joining us.
Thank you very much, madam.
As a start, I will start with a similar question that I posed to Dr. Letlape, whom I just spoke to a short while ago. Where do you stand on this issue of possibly going back to a harder lockdown? We've heard the Gauteng Premier quite concerned and saying this is a possibility. The numbers and infections, the number of infections and deaths are on the rise. We've seen, I'm sure those numbers are very scary. And of course, it does seem, as the package we've just shown before talking to you, that people are not really taking this particularly seriously, and elderly women asking, the younger people to indeed take this seriously. So where would you really stand on this call, perhaps to go to a harder lockdown, Doctor?
Well, I think what is of paramount importance from my standpoint is to strike a balance between saving lives and also allowing people to make ends meet. I'm not sure if one argues that we have to go back to level 5 in order for the virus to be contained. That will be a way out in this situation. I think government has been trying its level best in terms of making sure that the numbers are going down. But it must be noted that change starts on a personal level. One cannot only attribute the blame on the government side. Yeah. People have not been adhering to the regulations of lockdown in terms of social distancing and wearing masks.
Now, you speak about the government, but I will still ask, is there anything more that perhaps the government could have done in leading this fight against COVID-19? Or can we say that the government's really done all that it can? What's your assessment of leadership in this country in terms of dealing with a pandemic?
Look, there have been successes so far as the government is concerned, but at the same time, there have been weaknesses. For instance, here in the Eastern Cape, I think a whole lot more could have been done in terms of making sure that the numbers don't go down or rather go up. I think the capacity in hospitals is lacking. I also think that government needs to make sure that people are basically assisted in terms of some of the needs that they have to be given so far as this matter is concerned.
Dr. Breakfast, are we at that point, have we reached that point now where we just sort of wait and brace ourselves for those increasing numbers? I mean, every day you wake up and, you see that those numbers have gone up. I mean, what more at this stage can be done? Is it just a point now of waiting and treating those that do test positive and just really hoping for the best, although we are seeing that those numbers are going up quite significantly every day?
Look, there is no silver bullet. I think we need to appreciate that there have been successes. For instance, there have been a lot of numbers that have been reported on of the recovery. Many people have recovered in as much as some people have lost their loved ones. So I think government must be commended for a good job well done in so far as that matter is concerned. But I cannot give you a straightforward answer in terms of what needs to be done, chanting a way forward. This is a very complex matter. There has never been, I would say, a disease of this nature before, besides the swine flu. So one cannot draw from international best practices. But I think government is trying its level best, even though there have been some weaknesses as well.
All right, Dr. Breakfast, thank you very much for giving us your time on SA Today. We appreciate it. That's a political analyst, Dr. Ntsikelelo Breakfast, in fact, also a doctor.